Hello, my name is Roger Faulkner. Uh, I have ALS, and I'm an inventor too. I breathe with the help of positive pressure ventilators like this. I call this my air sipper. Another way I can breathe is with a nasal pillow, which is right there. I wear it over my head, and it sticks in my nose. Or I can breathe with a full face mask, which is how I have to breathe at night. See that? Well, all these things are pretty intrusive. This air sipper is the least intrusive because I get to choose when I breathe and it doesn't interfere with my nose and make me talk funny. But, it's funny. I'm not the only ALS patient that finds small things to be the most irritating. The inability to breathe normally and talk normally is a big deal to people like me. The old-fashioned iron lung, in many ways, was a very good kind of respirator. It breathes the way your body breathes. When your diaphragm muscle sucks in air, which I can't do, it's called negative pressure ventilation. Your diaphragm causes a negative pressure, and then afterwards, normally it's just the elasticity of your lungs, which is how you exhale during normal breath. If you want to shout, then you contract muscles in your chest and you can shout. But anyway, it's my little piece of the puzzle to try to come up with a way that I could have a negative pressure ventilator that I could wear. And of course, it'll be applicable to other people, not just ALS patients, but emphysema and various other conditions. I would love to be able to create a device that makes it possible to not be immediately seen as standing out. Obviously, if you're wearing a ventilator of any type, someone that looks close will be able to figure that out. But my vision is to actually have something that sucks my chest out. And that is the crux of my invention, and it's what I want to talk about in my TED Talk. I've been working with an individual, Benjamin Gotti, who made a makerspace at Queen's University. So it's got excellent Charlotte pedigree for a project here. And hopefully I can find, make the whole project a Charlotte project. I don't know whether that'll be the case. The big medical equipment innovation centers in the U.S. would be Boston or San Francisco. But who knows, maybe this ventilator, which I'm now calling the conformal vest respirator, will be a project that can happen right here in Charlotte, or at least in North Carolina. Thank you, and I hope to see you at the TEDx talk.